Right, okay. The last category is the non-prescribers. So they haven't passed their prescribing exam. Hang on. They haven't got their prescribing exam, so what they're doing with a prescription. So have the patient seen anyone face to face? No. So they don't have a prescription. So a non-prescriber is not allowed to have a prescription, and so we can't supply any of these products without a prescription to these practitioners. It's because they haven't got a prescription in the first place. Okay, good. Right, so let's just go down the list. Let's talk about sales orders. Northern Ireland and a doctor and dentist. So what can they have? Right, they can have a prescription only medicine, and the big concern with this is they're not allowed to have sales orders. This is your sales order. They're not allowed to have sales orders for things that we don't have a license to sell. So this is your specials and your blood products. Okay, don't worry, this is all on a big list that I'll give you. Each product, all the hundreds of products that we're going to be supplying, have each got their own treatment, and it will tell you who can have what in each country. This is just to give you an idea briefly of the different categories. So you don't have to remember this video. It was just trying to introduce all the concepts for you. Okay, so the sales order can't be given with a product that we don't have the MHRA license for. So it's blood products and specials. Okay, they can have everything else on the sales order in Northern Ireland. So that's all the other products apart from these three categories. Okay, let's move on to our second lot of practitioners. Now you treat the non-prescribers and prescribers the same with sales orders. So you've got the nurse, pharmacist, dental hygienist and dental therapist on the sales order. The big next thing we've got to watch out for there is these practitioners are not allowed to stock POMs. Okay, they're also not allowed to put on sales orders blood products. So how does that look? So they're not allowed to have the blood products, and they're not allowed to have any of the POMs. They're not allowed to stock them. So that's all of these products. So they're only allowed to order on a sales order P medicines, ones with a little P on them, and then the medical device and the consumables. Okay, so that's the only ones they're allowed to have in Northern Ireland, these prescribers, on a prescription. On a sales order. That's the sales order, the black one. Okay. Right, okay, there's another different category, a pharmacy and a wholesaler in Northern Ireland. So, we're not encouraging the supply to another wholesaler or another pharmacy, because that's effectively setting up a competitor. But let's just, for argument's sake, go through the lineup of the 10 different marketing groups of products. So they get pretty much the same privileges as a doctor or as a dentist. So they're allowed to have everything except for things we don't have an MHRA license for. So they're not allowed to have blood products, and they're not allowed to have any of the specials, but they can have everything else. Okay.